I think pain is so subjective and it's so hard. And there's a couple of studies that show either that parents overestimate their child's pain, but I do still think that it's better because it's better than not treating their child's pain, right? So I think that at the end of the day, we rely on parents to help us assess their child's pain. Children at the age of 4 for a quote unquote typically developed child can use the pain scale to assess their child, but even then we as residents, medical students, and physicians don't use those numeric pain scales well, and that's only one aspect of pain. I could really talk about pain for a really long time, and the way that we assess and treat it. There is so many different aspects about pain that we don't do a good job assessing and reassessing, and then how they respond to our treatment. And I think that parents are there a lot. I think our bedside nurses are there a lot, and there's so much subjectivity. And when we talk about bias, and specifically unconscious bias in Black patients in particularly, when we look at sickle cell disease versus CF and how that pain is treated and the inequities that exist there, it's astounding. And so, yeah, parents should be advocates for their kids' pain management, and we should listen to them. It's hard because then what happens is those cases of Munchausen by proxy, or those cases of parents, doing inappropriate things with their kids' pain medications, those get the news, those get the highlights, and then the rest of those kids who need it don't. But by and large, if you look at it, our caregivers are best assessment for those kids who can't advocate for themselves. And when we look at nonverbal kids, we need other ways to better assess pain. And until we have that, we've got to rely on our parents. Use that parent voice. You parents know what I mean. Use that parent voice. That works. I think something that parents can do is ask a question, which is, can you help me understand why you're not giving my child more pain medicine? It seems that you're afraid to give my child more pain medication because it could harm my child. And I'm not seeing that. Can you help me understand?